Okay, we're just going to give people a couple of minutes to join.
Nick is in.
Yeah, we've got Nick. Hi Nick, how are you?
Hi.
Great to see you. We're just waiting for a few more of the participants to join. But it's a gorgeous morning, isn't it?
Yeah.
Yeah, hot. It's boiling.
Yeah, it's nice.
It is good that you told me to sit this way because all the air is coming in. Yeah. So I don't have my back blocking the air.
Good. So we're just waiting on a few more people to arrive, and then we'll get going. Good.
So you're putting them in a waiting room.
I think the people are coming through now. Yeah. Good. So we'll just give it a couple more minutes, and then we'll get going. So hi everyone. Hopefully you can all hear. If you can hear us, just pop something in the chat just to let us know that you can hear us. Okay.
Yeah. Okay. Did you manage to put a key to those risk factors? To what medium, or what low standard and high medium?
I did come back to you on that, Marjorie. I couldn't see that in the pack actually, but I think we'll be okay just talking through them, will we?
Okay, it's just below.
We're just starting now, Marjorie. So we'll get going with the slides. People are just joining now, so okay. We're ready to go, I think. So if someone could just pop in the chat of the participants just to let us know that you can hear us, okay? Can everyone hear us okay? Sorry, just making sure that the tech's okay.
We do certainly have everybody join. There you go. If you click on there, you should in the chat. Yeah.
Great, so you can hear us. Sorry.
Fantastic.
Great, good stuff. Okay, so we're going to get going then. So thanks very much for joining us today. Sorry, there we go. Ian's going to talk you through a little bit more detail about what the webinar is going to be about, but just for those of you that are joining now and don't know much about your people associates, we're an HR consultancy and we work with a number of associates, so we can really help our clients to look across their whole people cycle, and we put in place the associate with the specialist knowledge and skills that they may need in their business. So if you're an HR manager and you're a generalist, sometimes you may need some expert help in different areas, and we're able to flex and find you the right associate. So that's us in a bit of a nutshell, but we'll talk about that going forward. So over to you, Ian.
Thanks very much. And first of all, I just want to welcome everybody to the webinar today. I can see that we've got some of our valued clients who have come on to see us today, and also some supportive ex-colleagues, and we're very grateful for you sparing the time and coming on today. I'd first of all like to say a special welcome to two of our panel guests today. We've got Nick Powell, who's the CEO of SOM, and he's kindly agreed to make some time for us today. I know he's got a very busy schedule, we appreciate that, to give us an overview of the toolkit. Welcome, Nick. Thank you for coming. And I'd secondly like to say a very special thanks to Marjorie. Marjorie is a former colleague of mine. We work together at Metronet Rail. She's currently a lecturer in occupational health at the Brunel University, London, but she's held previous senior frontline business roles. And I think she brings a very unique blend of academic and very practical expertise. So thank you very much, Marjorie, for coming today. I also hope you don't mind me saying that, but when we first reached out to you, you actually were were unwell with the virus yourself, and I know you've been under a lot of pressure, catching up and getting yourself back into the swing of things again. So we are really very grateful that you've made the time between all your volunteering and your own work commitments to make the time for us today. So again, special thanks, Marjorie.
Thank you.
So I think we've all been moving on. So I think we've all been touched in one way or another by the virus, and responses, I think, have varied from organisation to organisation. I mean, we got a challenge, or I got a challenge yesterday in conversation with somebody about whether it actually was a return to work that we were talking about, with that being something of a sort of retrospective. I think many different people are in many different places at the moment, and I think we're going to explore that as we go through the presentation today. You know, we also can't force people to return to work. We need to engage them, and it's about making sure that people are comfortable coming back, and that they're coming back to a supportive environment. And we hope today to give you some very practical examples and tools that you can use and adapt in your own businesses to bring everybody back under the sort of banner of the SOM toolkit. And I'm very pleased to welcome Nick, who's agreed to give us a bit of an overview of the toolkit and say something about some of the other organisations that have been involved, and then we'll have an opportunity to have some Q&A at the end of the session. If you can put your questions as you think of them in the chat, we'll collate them and we'll answer all the questions at the end.
So great, thanks Ian. So over to you, Nick, to just talk us through some of the contributors to the kit and why it kind of came about.
Thanks very much, and well done, Ian and Nicola, for hosting this, and also it's great to have Marjorie here speaking. I think it's obviously been a difficult time, and we produced this toolkit with MIND, mental health charity, business in the community, CIPD, the HR people, and ACAS. So a very strong partnership, and I suppose the main point in that toolkit is really to look at your workplace assessment, your risk assessment, and the individual assessment, and that combined will help you to produce a return to work assessment. And I've sent details on the chat of the toolkit, but also some more technical advice in terms of COVID age. And people obviously have different risk factors. If you've got underlying health conditions, it might put you in different categories in terms of COVID age being the main contributor to your risk. So on the serious side of your risk to COVID, we've got a tool that can help people, hopefully reassure them that they're not as much as risk as people think. I've just come off a call with something called the Leadership Council, which is a national body with people like the CBI and Federation of Small Business, chaired by the chairman of Barclays Bank, and that's focusing on mental health. And I think mental health is a real concern. I mean, I think we're in a way sleepwalking into a very serious downturn, people coming off furlough in the autumn, but people are already showing signs of anxiety, the isolation of working at home or being furloughed, caring responsibilities, financial difficulties inevitably there, and support needs to be there for that. Bereavement, people who've very sadly passed away, the workplace issues for that. Domestic violence and abuse has clearly increased, and also concerns around sort of alcohol and substance misuse and gambling. So I can't emphasize enough about sort of mental health issues. I mean, I think there's particular concerns just from this meeting, national meeting, on the difficulties faced by black and minority ethnic groups, with what happens in the States, and what that means just generally in terms of people perhaps feeling more risk from BAME communities in terms of redundancy. I think death and bereavement is also a big issue, and sort of working at home. But for small businesses such as yourselves, all this might feel quite highfalutin. The toolkit might seem a bit complicated, and occupational health even more kind of remote than thinking about getting HR. You're dealing with sort of things as they come. And I suppose this toolkit is something that hopefully will help you sort of assess where your employees are and reassure them that you can sort of get your business going. A lot of businesses aren't even getting an income at the moment, and obviously very, very concerning. But I suppose an overall view is the evidence is there. You know, you might not believe me, but the research is there that if you do invest in your staff and their well-being, then your income from sort of revenue increases by up to 10%. So there's very real commercial benefits of focusing on sort of health and well-being and the occupational health of your employees. You know, I'm conscious that occupational health isn't an easy kind of thing for people to contract with. If you go on our website, you can see people to contract. But I'd welcome, you know, share my contact details with everyone about how we can improve our offer to small business, because it's not easy. And I know the government's concerned about that too, and often it just ends up going to your GP, and but actually using a specialist for complicated cases, as well as sort of taking an overview of how you can, just like your sort of computer IT systems, looking after your people is as important as IT, if not more important, obviously. So I think I'll leave it at that. I mean, you know, we you know, really pleased to be part of this, and I'll hand you back to Marjory and Ian. Thanks so much.
Thank you very much again, Nick.
Thanks for that. So we're just going to move through now. Sorry, apologies. Ian's just going to talk us through like where your people may be at the moment.
Yeah, I mean, I think this builds on a number of the points that Nick had made there. I think it's fair to say that lots of different people are going to be in lots of different places at the moment. We've had a number of people working at home for quite a prolonged period now. You may not have had the opportunity when they first went off to do a risk assessment. So, you know, if it's going to be continuing for a while, the best thing for those people is to remain at home. There is some links in the toolkit to enable you to do a home risk assessment and make sure that people's posture is correct and that, you know, they've got the basics that they need around them to be able to function normally from home. We've also got people who have been looking after others. They've been on care leave, and they're going to need a little bit of space and time, and that's likely to be something that continues for some time, because there will still be people becoming sick and having to go into isolation. I think we need to just be mindful of that and make sure that people are given that little bit of time and space. We've obviously got a group of people who are furloughed and maybe going on to extended furlough, and they may feel a little bit out of the loop a little bit on communications and things like that. And I think it's important that we continue to address the whole workforce and make sure that everybody feels that, you know, they're getting the same messages and the same sort of reassurance and the same information going down on government guidance. It's important that we keep everybody informed. Communication and all of this is key. Obviously, unfortunately, there's a number of people who will already have been released or made redundant from work, and you know, those that are remaining in the workplace are going to obviously be feeling for their colleagues and the survivor syndrome, and a lot of people are going to be finding it very, very tough. So, you know, very important that we provide some sort of support for people in these circumstances. And again, I think there's a lot of good free resources within the toolkit that can help people at these really unprecedented, difficult times. There's some people who are going to be returning to work, and obviously with some anxiety. I mean, yesterday was the first day that I had to go on the tube network in about 3 months, whereas my partner, she's a nurse and she's been going into work every day. So I think, you know, lots of different people in lots of different places in that respect. Some people who have perhaps had to be in frontline roles and have worked all the way through, and others who, you know, are returning for the first time, be it for, you know, commercial reasons and they can't do their work from home, or they're going back to sort of more frontline or public facing jobs as we start to relax a little bit. And we are going to touch on a little bit, I know Nick mentioned there around the vulnerable individuals. We've also got a resource where we can help businesses to kind of assess what constitutes a vulnerable individual, and I think we'll touch on that a little further on in the presentation. So without further ado, I'm now going to pass over to Marjory, who's going to take us through some of the various control measures. So Marjory, over to you.
Thank you. Sorry, I was muted there. Just want to go back to your slide regarding vulnerability. So I think a lot of people, we know they're talking about shielding, but the science or the thinking behind it is that vulnerability is the risk of dying from COVID-19 infection. And there's several factors that make people vulnerable. So the risk of getting infected plus the risk of the seriousness of the illness will, through the serious illness, death can arise. And that's what vulnerability is all about. So it's more about individual protection versus transmission. So the governments at the moment, they talk about people vulnerable to include those with conditions, long-term conditions, asthma, diabetes, heart disease, weakened immune systems, pregnancy, although there's still, some discussion, people age 70 or over, and those are seriously overweight, a body mass index of over 40 or above. That's what vulnerability is all about. And then it goes into, because at the moment, what we knew 3 months ago keeps changing. So if you think about the vulnerability, I know the day we were asked to leave the university, they were just spot on. They included people with high blood pressure. At the time, personally, it wasn't quite clear to me because I was thinking it should be respiratory, but there's so many studies going on. But at the moment, we work according to the government guidance. So going to the slide, so to do workplace control measures, we're using what's called a hierarchy of control. This is quite common in health and safety, in occupational hygiene. So you start with, you look at, can we eliminate the hazard? So in this case, we're talking about coronavirus. So the elimination is about working from home. So how, if people can't work from home, what do you do? How do you substitute that? You can use technology. We're doing it now. I'm working from home, but you are. So that's the substitution. So what we're talking about right now is the workplace, not the individual.
Okay.
So,
So that's interesting, Marjory, that obviously the different types of businesses, some people can absolutely work from home. And as you say, we've all been doing that for quite a while now. And interestingly, we know productivity is not necessarily being affected, which is great. But turning our attention to some other businesses, like cafes or construction companies, they obviously don't, necessarily have that luxury. So, as we work through these things, it would be nice to consider the different types of companies and how, they're managing this as we go through. So
you'll see as we go down the slides, you start off with, do we have to do it? That's the other way of talking about elimination. So we can say, do we have to do what we're doing? So in this case, do we have to work? Yes, we do. So what can we eliminate in terms of exposure to coronavirus by staying at home? So if we go to the next slide. So engineering controls. For people who know about health and safety, mainly control of substances hazardous to health, this fits in very well in terms of, can you engineer out the process? So in this case, we're talking about, can we engineer our exposure? So we look at individual workspaces. This is where, Nicola, your question comes in.
Mm-hmm.
So, okay, so I can give an example. In my office, we can sit at a distance from each other, but we're touching. We don't hot desk. So these are the things that managers need or companies need to start thinking about. Are you able to social distance? So if you think about hospitality, this is what they're talking about. World Health Organization says 1 meter.
Mm-hmm.
We're saying 2. Australia says 1.5. Somebody else says 1.4. And what I'm hearing from other businesses is they'll keep the 2 meter as a safety net. But we're just talking about how you engineer out problems, flow markings, so that you control the movement. We're getting used to that if you've been to like supermarkets, mainly places like B&Q. You just go in one. In supermarkets, it doesn't quite work very well to be going in one direction, but that's what this is about. And whilst you were talking about other companies, many people losing jobs, the people who make signs have made money. I've even seen it on LinkedIn. They've turned things around so quickly. So whilst other businesses are struggling to make these engineering controls, the people who aid them to do that are actually benefiting. And then you have to segregate your employees. So in supermarkets now, they've got the Perspex screens. Nick knows I am very much about not believing in the temperature checks, my personal opinion, because temperature can rise due to different things.
Of course.
Because it's what the government is saying.
If you're an employee of a company and someone is insisting on taking your temperature, how would you handle that as an HR kind of operator? If some of your team, they don't want to have their temperature taken?
So I think it goes back to company rules and procedures, because ACAS has been involved in this because of the workplace relations.
Of course, yeah.
From an HR point, we have malingerers, we have people who fear. There's different behaviors, but there will be reasons why temperature is not a predeterminer. Mm-hmm. In my opinion. So you could have an ear infection, you could have some infection going on in your body, not necessarily coronavirus, not necessarily that you can transmit whatever you have to somebody else.
So would you advise there then to perhaps just then refer someone to their GP before making a decision? Or?
So when we're doing this, it's about productivity. It's about making sure people are in work with adjustments. Mm-hmm. So, yeah, I don't believe in that personally, but everybody's working according to government guidance. Mm-hmm. And,
it's making these environments quite sterile, literally, isn't it? Which I think is having an impact on the kind of almost joy of being invited to go back to work, is that we're starting to see from some of our clients that, the employees are finding they're quite excited almost going back in some cases, and then they get there and actually what they used to know as their kind of fun, nice culture has changed quite dramatically because of all these pressures. So, I think it would be good at the end to maybe address some of those things and see what we can do to kind of, encourage people to keep these guidelines, but also to make sure their culture, remains as it was.
It's true, actually. when people aren't getting a good experience of traveling into work before they even get there, and then they're getting there, and you have to argue when restaurants are going to open, probably the experience of going for a meal is not going to be the same either. It's going to be quite a different world for quite a period of time.
Yeah, yeah. And then we've got the hand hygiene measures, staggering use of canteens and social distancing. So the toilet facility use, traffic light, we're just in a new era. And this is probably going to be the way life is going to be. And sooner or later, it just becomes second nature. Someone mentioned the fact that we now fly and go through all security. We never used to, but now it's just part of us. It sounded very disruptive. And I know, I think 2000, sometime I was 3 hours early, but I nearly missed my flight because they were trying to get systems in place, people were trying to adapt and everything, and people almost fighting in the queue. So, yeah.
We're hoping that we'll adapt. So just moving then through to the next part.
Yeah. Yes, please.
The administrative controls.
So the next, okay. So administrative controls, it takes us back to, we've now done the elimination, the substitution. So people have to go to work. We've established that we need people to go. So how do they go to work? If you think 4 months ago we were encouraging car sharing, we've moved on from that to say people should be traveling by themselves or people from their family. So that means parking. I don't know what it's like in London because very
busy at the moment.
So with Ian, we worked in London. You'd never even dream of driving to work. It was impossible. Yeah. So this is the next stage, and then the social distancing. And while people are traveling to work, that's why they're now saying wear masks, which I totally believe in. And having suffered COVID, still recovering, I go out, I see people without masks, I get so frustrated because I'm thinking, I'm wearing it so that we all wear it. So me wearing my mask doesn't protect me from you. So behavior can take over as well.
There's no policing of that at all, is there? If you go on public transport, there isn't actually anyone enforcing the mask wearing, which is a shame.
Yeah. So we'll move on because these are some of the things that people now know. So when SOM released this, the government hadn't gone into this, but now this is what is going on: staggered arrival times, clear guidance, increasing COVID-19 safety precautions. So I'm quite keen to move to the next. So the PPE.
On the subject of PPE, Marjorie, there was a query that had come up the other day about somebody who had sort of personal anxiety about wearing this at work, and they were citing claustrophobia and things like this. What sort of advice would you give if that sort of query came up at all in the workplace?
So the most important thing at this point in time is to talk to people, understand their fears. Because wearing a mask is completely new. So before I went to Metronet, I worked at BP Oil. It was a refinery. People wore masks. We were working with in very hazardous conditions. So it is a cultural thing. And anyone working in those, so if you see people working in construction, so for people that we can see every day, they've got all their PPE. So we have to accept that this is completely new.
Yeah.
Understanding people's fears, talking to them, looking at what could be the alternative. And if people, because some people have got genuine reasons. The breathing could be one thing, the claustrophobia. And they were talking about people who've got hearing loss, because they also, they depend on lip reading. So
of course,
it's a whole lot of things. So it's good to sit down, find out why they're concerned, and there will be things that will come up as a solution.
And I think we touch on that in a little while when we come on to some sort of common questions that will help to sort of draw this thing out in a conversation. I think it's on one of the later slides that Nicola will take us through.
Great.
Yeah.
Okay, so shall we move from the PP then? I think we have an example, don't we, of...
Yes, this is a workplace risk assessment example. We within the pack, there's a questionnaire that you can fill out to assess a particular role. But what we thought might be useful would be to give you a worked example that we could maybe work through. So the example we've got here is an office administrator working in a financial organisation that's close to the general public, but they're working in a role that can't be carried out effectively at home. So the member of staff does need to travel to work by public transport, but flexible start and finish times can be accommodated for the job, so they don't have to travel at peak periods. Other members will also be at work, but the numbers have been reduced to allow for social distancing and just, to try and keep people apart, and non-essential people perhaps not been returned to the workplace. And all staff have had regular communications about hygiene and home isolation rules if a household member is displaying the symptoms. So everybody's been issued with hand sanitizer, and hot desking has been forbidden, and cleaning sprays are available, and the use is encouraged. So that would be in your sort of common areas of the business. So that just gives you a little bit of background. And Marjorie, if we can move on now, what we've done is we've pre-populated this risk assessment example, where we've tried to assess this from the low level through to a high level of risk, and a number of risk factors which we've taken here. And actually in the pack that we're going to send out after the webinar today, we've also got an example of this that can be adapted. So if it's something that you want to use for a particular role in your organisation, you can do that. We're just going to, with the help of Marjorie, look at that particular example and look at why we're not thinking that there's a particular risk associated with this example that we've given here.
Okay, thank you. So what I've done is in the chat so that people can follow this. I've put what low, what standard, what very high risk is, and then people can respond in the chat. Yeah. So that person we were talking about. Okay.
Oh,
sorry.
Sorry, we're just going the wrong way.
So going into the chat group. Oh, this has got the answers. So the reason why they're saying it's a low risk, it's because they are not in a patient care. So the risk IDs are 9. And then you look at the risk factors. And then you look at the classification of the risk. But you're still taking control measures into play. So first of all, we're saying, is it a patient care or individual care for the community or public facing? Because they're not in that role. It's a low risk.
Yeah.
Do people agree in the chat?
So people are talking more about the temperature checks at the moment in the chat, but if we continue to go through the example, I'm sure there'll be more.
Oh, that's fine. Okay, so then we go to ability to maintain social distancing at work greater than 2 meters. So why we're saying it's a standard risk here? It's people with no health conditions or risk factors that would place them in that higher risk group. Again, they should still be practicing hygiene and social distancing precautions. And I've seen a bit of the chat where they're saying if you've got a temperature, you shouldn't be at work. So you're still practicing the right things here. And then we go to risk ID number 3. So number of different people sharing the workplace. It's still standard. And then travel to and from work. Let's see, what was the...
So they've made some adjustments there, haven't they, and allowed people to vary the start and finish time. I mean, I think overall, in terms of the way that your example was framed, Marjorie, the employer had actually gone to some quite significant lengths to reduce the risks in the first place. Wouldn't you agree?
Sorry, I didn't, you were...
Beg your pardon, Marjorie. I was just saying that I thought from the example that you'd given us that the employer had actually gone to some quite reasonable lengths already to try and reduce the risk and enable us to assess it in this particular way. Because I think if they had, if they hadn't put some of those measures in place, we may not be looking at such a kind of standard assessment.
That's right. Yeah. So it becomes standard because you're practicing the social distancing and other precautions. And then the number of different people sharing the workplace is still standard. Travel to and from work. They have to travel to work. So it's standard because there's no clinical pre-existing conditions there. And then the workplace entry and exit. What is the risk? So when you look at that risk factors, you're looking at,
Sorry, I think the presentation is timed and it just moves forward. So I think we probably covered most of that, I think.
That's right.
Because it was quite standard examples, wasn't it? So apologies for skipping on there.
No.
Moving on from those examples then, obviously we may want to reconnect, as Ian was saying earlier, with staff coming back into the workplace. So these are some typical questions that you could ask. You may have, your own questions, but these are just some examples that we thought were relevant. And really just to get that relationship going and just understand where, gauge how nervous or how anxious people are about coming back in. So, just catch up with them, ask them how their life's been, if they've been caring for somebody, how have they coped with the lockdown, if they've been furloughed, or perhaps if they've been working from home all the time, if they managed to take a break. I think a lot of people have thought, well, I'm at home, I don't need to take my holiday. But actually, if they've still been working, they might be, quite sort of exhausted by now.
Sure.
So, how they're feeling about coming back and how safe they're feeling. Maybe if any adjustments that you could make as the employer to make their job a little bit better, to make them feel safer. As we've said, some of the examples might be about staggering times, rotating days in the office, that kind of thing. And then, how do they cope if there's any problems that are coming up? Is there, a mechanism in place that you can make sure they know about, so that if they do feel anxious about any of this, they don't just share it with colleagues, they're actually escalating it to the management team. So there's a template in the pack, but obviously you can populate it with some of your own questions as well. But we do recommend highly that you do this with every employee in the business.
So what else can we do to help? I think giving people a bit of time and space to readjust is good advice, because I mean, you know, this is a big event. People have been at home or in, you know, very different places, as we saw on the earlier slide, and now they're beginning to come back, and it's going to take a bit of time to readjust, as it would with any change, I expect. Encourage people to talk about their experiences, so not only on the one-to-one basis, but maybe when you're having team meetings or you're having town halls, then open up the floor and ask people to share their experiences. And I think that allows them to understand where people have come from, how badly things have affected them, and those people that may need a little bit more help or empathy at this time. The critical questions that Nicola took us through to support some of the one-to-one conversations are good, and we need to ensure that no groups are becoming isolated. So we touched on before that some people may have been on furlough and be remaining on furlough. We need to keep them all part of the fold, and promote some of the services that we've got there to support. So there's some fantastic information in the pack from MIND around mental health at work and associated action plans. And also there's an organisation called Fit to Work, who are an occupational health service themselves, and they're free for employers to access and get points of reference from. Is that right, Marjorie? Is there anything else you would say about Fit to Work?
Yes, so it's a program from the government to enable those companies that can't afford their own occupational health, because it's all good. I'm talking because I work in organizations that have an occupational health department, but every employer, as we're saying, good health is good business, wealthy business. So if they don't have occupational health, the government has got the Fit to Work program.
We've got details of that also in the pack. So if it's something that you would like to access on behalf of your employees, we've got that there. And just to sort of sum up before we move to questions, I just want to highlight the sort of 5 main points that the government have said that all reasonable employers need to ensure that they're doing. The first one is to carry out a risk assessment in line with the HSC guidance. So we've got links to that in the pack, and you can access all the templates and associated things there. Develop cleaning, hand washing and hygiene procedures. Again, in the pack, we've got some useful links that will take you through to a template that you can adapt and use for that. Help people work from home. I think that was the very first point in Marjorie's control mechanisms was to have people working from home, and I think that's still best advice is if you don't have to come to work, then continue to work from home. Maintain the social distancing measures. I think people are fairly aware of what that is now, not be it only from going to the shops to experiencing any sort of day-to-day life at the moment. I noticed some of the cafes around here when I was coming around are also putting in one-way systems. So you can really see how that process mindset is translating itself to all businesses. But where this may not be possible in every business case, then we want to ensure that you manage the transmission risk. So I'll not touch on it now. Everybody who's attended today will get your email addresses, and we'll send on a copy of the full pack, which I think has been linked not only in the presentation here today, also in the chat. We've got some other aspects of the pack there, ranging from ACAS to the CIPD, where there's a lot of useful resources and templates and template letters and so on. And the mental health gateway information that I spoke to you about, there's a link for that there, and also Fit for Work, which we touched on at the end there, which is the free occupational health service that Marjorie touched on for us there. So that will go out sort of following the webinar today. But has there been any anything come up in the chat at all, Nicola, that anybody would like to highlight? Or
yeah, so just before we go into sort of any of the questions, I just wanted to mention that we've got about 8 slots left for next week now. For each week we run a number of slots for clients to have free consultation calls. And if people let us know in advance what their issues might be, or things that they could be struggling with, or advice that they need, we try to also get that particular associate onto the call as well if we can, to try and help you know, with your questions. So as I say, I think we've got about eight slots. I looked in the diary before we came on today. So if you do want to grab one of those slots that do tend to go quite quickly, because you know we only have so many each week, then you can go onto our website, follow this link, and you can book in your slot there. So you know, feel free to do that and give us a bit of background when you fill that in. So I think if I just go back, there was a couple of comments in the chat earlier about the temperature checks. I know that I asked you, Marjory, about what to do if, you know, an employee does have a high temperature. I think people are you know, still interested to know a little bit more about that. We've got someone here saying that they shouldn't be at work, but it's not a sign, you know, sign of COVID. So what would you say to that? I think, you know, you mentioned before, it could be a different ailment, but what do you actually say to your employee?
Okay, so from an occupational health point, that answer is quite accurate, that you shouldn't be at work. But I don't know whether transmission would be, I don't know whether infection, temperature is one of the signs. I've been very, very unwell. I never had a temperature, ever. So I sort of argue from a personal experience, because we know that. But then again, people might be developing symptoms. So that I would still feel that it's really up to people what the company believes in, what the government is saying. And because some people have had a temperature and they've been unwell, I haven't had, and I have been unwell. So I don't know, can people respond what their feelings are?
I think, yeah, we've probably covered that. I think some other things that we're finding people are mentioning when we have these calls with people is, you know, about the anxiety of people. I think that's definitely coming up over and over. And, you know, as we've talked about some of the resources in the toolkit, for managing, you know, this mental health issue, and we talk a lot about mental health, but if you're you know, an HR director of a small business, you've already got a lot on your plate. So, you know, how would you advise me to talk to the team about what they can do for themselves, as well as what we can do for them as a business?
That's a good question.
Okay, so this is where occupational health comes in. And the reason I know Ian is because as occupational health, you work closely. So you're the side of the people is HR, we're the health side. So that needs a dialogue to see what exactly is going on. And as you've just seen, the government tries to support so that people are kept in work regardless of the conditions, or they come back with adaptations, or they remain off sick until they're able to come back with some adjustments. So speaking to occupational health is what I would recommend. And then we look at a case by case.
Okay, that's good advice. Thank you.
Are you aware of any sort of training that a small business could access, Marjory, where, you know, they may nominate somebody as being, you know, either, I've heard it called in the past a mental health first aider or something of that sort of nature, where somebody could perhaps be nominated on behalf of the business to go and get some specialist training and perhaps bring some of that learning back into the organisation?
So I can talk from personal experience. ASDA would get us as occupational health to train managers. In Metronet Rail, we had BUPA, where our OH service provider.
Right.
I don't know if you were involved. So it's good to have somebody who gives you an overview so that you know what to look for, not as an expertise, but someone with some knowledge. Because the problem that people end up with is sometimes HR, because they're different specialism, their expectations are different. So some companies do that. They have a day awareness refreshers from an employment and human relations point, and also involve the unions if you have them, so that they understand what occupational health is trying to do.
Yeah, I mean, one of the things that particularly impressed me with the toolkit was the emphasis that there was on sort of mental well-being and you know, supporting from a mental health point of view. And I think it's something that throughout this whole pandemic, we've really seen come to the fore. So there's a lot of discussion around it in, you know, webinars like this and a lot of the HR press and so on. And you know, I think it's something that I felt there was a lot of support on and a lot of engagement. I guess the templates from MIND in particular, I thought were very, very useful.
Yes, yeah, definitely.
So just, I mean, we've got a couple of minutes left now, just before we wrap up. But just looking forward, you mentioned earlier, you know, that obviously this has been a huge change. A lot of companies have managed to pivot, which is great, you know, so it's not all bad news out of the virus. But, you know, turning our attention to where we're going to be in the next 3 to 6 months, what do you think that the new sort of norm, the new workplace is going to be like, Marjory?
The new norm is going to be strange. We will adapt to it. It's not going to be back to the old ways, and we know that. And there've been spikes back again in Germany, in the US, and the virus is still with us. So the norm is talking to people. I know in my organization, they're having consultations. We don't know what the results are yet, to see how they can address individual specific. Okay, they're not even individual, they're collective. A lot of people are experiencing the same thing, which takes me, because I've got a question in there. Is that what you've just what's your advice for employees who don't want to return to the office for either physical or mental health reasons, whether furloughed or working from home? So people who don't want to return to the office, we need to speak to them, find out why they don't, which is what I was talking about earlier. Because of their physical, I'm experiencing the same. I'm not very confident about going out. Luckily, we're not going back until next year. So the best thing is to find out, look at the company policies. I know, so talking about being furloughed or working from home, when we had ACAS on a webinar, they were talking about that it's all about the unions, and it's all about relations, and other people will feel that, okay, we are back at work. These guys are furloughed. We're working, they're not. They're still getting paid. So it's a discussion, company policy, looking at what the law says. It's very, because otherwise employers will end up in tribunals. So ACAS would be a very good place to seek guidance from.
We've actually included in the accompanying pack a bit of a flow chart as well, which will hopefully help to you know, HR teams to sort of triage some of these issues. And you know, I agree with you entirely. I think the the key to this is conversation and finding out exactly, you know, what people's underlying issues are, and trying to address them. But what we've tried to do is put a bit of a flow chart in place there that will hopefully help HR teams and line managers to manage those through to the right sort of conclusion, because I think you mentioned earlier there is always some sort of bad apples in the barrel, and people who, you know, are sort of maliciously not wanting to come back to work for one reason or another. But also, you know, I think we have to also realise that some people have got some real genuine underlying reasons as well, and we need to try and open those up exactly as you said.
The other thing I didn't mention, because of all the COVID instructions, some people now have caring duties that they didn't have.
That's a very good point.
Not only children, but maybe older relatives or people who've become unwell. There's so much that's gone on out there. Some people have become very unwell that they can't do what they've been doing because of COVID.
So I think we've just got a couple more minutes left, so just apologies for any technical issues that we had as we were going along.
We had to manage it ourselves a little bit today. So
yeah, we're still learning in this new Zoom world. So if there are any other questions that you think of afterwards, then obviously please do drop us a line, send us an email, and thank you so much, Marjory, for joining us today. It's been great to have you, and wealth of knowledge that you have.
Thank you for inviting me. It keeps me updated. Yeah.
It's good to see you looking so well again. I'm glad you're recovering.
Thank you. Thanks so much.
And thanks to everyone for joining today. We really appreciate your support. And as I say, if you do want to pick up on a quick call next week, then do sign up on the website for one of those free consultations. But great, thanks so much everyone, and we hope to see you again soon.
Thanks again. Thank you again, Marjory. Bye-bye.
Bye,
Take
see
care.
you, bye.